Ms. Jones, my name is Tuba. I'm your nursing assistant and I'm here today to provide with the Peri Care. Before we start, let me go ahead and wash my hands and I'll be right back. I wash my hands for 20 seconds and I'm back. I want to make sure your bed is locked. And before I provide that privacy, can I go ahead and check your ID bed? Yes, you're indeed Ms. Jones. And let's go ahead and provide you the privacy. Ms. Jones, before we start, I'm going to go ahead and get water and I'll be right back. So I get my water for comfort level. I test that water, comfort level. Ms. Jones, can you go ahead and test that water if it's your comfort level? Okay, awesome. She liked that. So my hands are clean. I wash my hands again. And I'm going to go ahead and put my gloves on. Ms. Jones, I see that you don't have a barrier down there. So let's go ahead and put the barrier on a count of 3. 1, 2, 3. You're doing great. Okay, let's make sure that no wrinkles. 1, 2, 3. Okay, let's go ahead and provide you the privacy too. So again, what is it? Dirty sides and clean side. Ms. Jones, you might feel a little bit cold down there, so we're going to start cleaning you. So I'm going to go ahead and wet the towel, my mitten. 1, 2, 3, 4, 5. So I'm going to go ahead and put soap after wet my mitten, let it roll the surfaces. I'm going to go ahead and on the count of 3. Ms. Jones, you might feel a little bit cold down there, so we're going to go ahead and clean you. I open the labia from front to back, one side, front to back, other side, and front to back in the middle. I'm going to go ahead and rinse you up, wet the cloth, go ahead and open the labia, front to back, front to back, and front to back. Now I'm going to go ahead and pat and dry. Ms. Jones, pat, 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 pat. Okay, awesome. Actually, we're done with the front, so on the count of 3, I'm going to go ahead and ask you to turn to your side. 1, 2, 3. You can ask the proctor to hold this mannequin. Okay. Okay, Ms. Jones. And the same procedure for here. I'm going to go ahead and wet it. Go put soap, litter all the surfaces, front to back. And the other side of the towel, front to back. And the other side of the towel, front to back. Now we're going to go ahead and rinse you. You're doing great. Wet your towel, front to back, front to back, front to back. Now I'm going to go ahead and pat dry, Ms. Jones. Pat, 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 pat. We're all done. Actually, before I put you to your side, I'm going to go ahead and roll this barrier away from my uniform. 1, 2, 3. Let's go ahead and put you down. Let's cover you up. Away from my uniform. I'm going to go ahead and toss this to the designated area or to hamper, right? I have more stuff actually coming up. Let's go ahead and put it in the hamper. Designated area. Don't press, whatever is out there. Pat dry and put it in the designated area. Go ahead and roll this barrier away from your uniform. Go ahead and throw it to trash. Make sure you put your hands away from your face because you're taking those gloves out. Take them properly, toss it to trash. Wash your hands. Come back to Ms. Jones. Ms. Jones, is there anything I can get you? Nothing? Okay, I thank my patient. I give her the call light. I make sure her bed is locked. I undo her privacy. I wash my hands and I'm done with my procedure. Clear?
Before